Vitamin A deficiency. You are sitting in a dimly lit room in the evening, and you start noticing that your eyes are struggling to adjust to the low light. Objects around you appear less clear, and moving through darker areas becomes difficult. This type of problem is commonly associated with vitamin A deficiency. Vitamin A is essential for the normal functioning of the retina, the light-sensitive layer at the back of the eye. Inside the retina, vitamin A is used to produce a pigment called rhodopsin, which helps the eye detect light in low-light conditions. When the body does not have enough vitamin A, rhodopsin production decreases, and the eyes lose their ability to adapt to darkness. This condition is medically known as nyctalopia, or night blindness. Foods such as carrots, sweet potatoes, spinach, eggs, and dairy products provide vitamin A that helps maintain normal vision and immune function. Vitamin B1, thiamine deficiency. You start noticing that your body feels unusually tired even after normal daily activities. Simple tasks feel more exhausting than they should. This can happen when the body does not get enough vitamin B1, also known as thiamine. Thiamine plays a critical role in cellular energy metabolism. Inside the body, it acts as a coenzyme in biochemical pathways such as the Krebs cycle, which helps convert carbohydrates into usable energy. When thiamine levels become too low, cells struggle to produce enough energy, especially in tissues that require a lot of energy like the nervous system and the heart. Severe thiamine deficiency can lead to a condition called beriberi. In dry beriberi, the nervous system is mainly affected, causing muscle weakness and peripheral nerve damage. In wet beriberi, the cardiovascular system is involved, which can lead to swelling and heart problems. Foods such as whole grains, legumes, nuts, and meat are common dietary sources of thiamine that help maintain normal nerve and metabolic function. Vitamin B2, riboflavin deficiency. You may begin to notice small but uncomfortable changes in your body. The corners of your mouth can start to crack, your lips may feel dry, and the tongue might appear unusually red or swollen. Sometimes the eyes may also become sensitive to light. These signs can appear when the body does not get enough vitamin B2, also called riboflavin. Riboflavin plays an important role in cellular metabolism. It helps the body convert carbohydrates, fats, and proteins into usable energy. Inside cells, it functions as part of coenzymes known as FAD and FMN, which are involved in many oxidation reduction reactions. When riboflavin levels drop too low, tissues that renew quickly, such as the skin and the lining of the mouth, are often affected first. Foods like milk, eggs, green vegetables, and whole grains are common dietary sources of riboflavin. Vitamin B3, niacin deficiency. You may start feeling unusually tired, weak, or irritable, and sometimes notice digestive issues like nausea or loss of appetite. The skin, especially areas exposed to sunlight, may develop redness, scaling, or rough patches. Mental changes like difficulty concentrating can also appear. These problems can happen when the body lacks vitamin B3, also known as niacin. Niacin is essential for producing NAD and NADP, coenzymes that play a central role in cellular energy metabolism and DNA repair. Without enough niacin, cells cannot efficiently produce energy, especially in tissues like the skin, digestive tract, and nervous system. Severe deficiency can lead to pellagra, characterized by the 3Ds, dermatitis, diarrhea, and dementia. Foods such as poultry, fish, peanuts, and whole grains provide niacin and help maintain normal metabolism and skin health. Vitamin B5, pantothenic acid deficiency. You might notice unusual fatigue, a feeling of weakness, or a tingling sensation in your hands and feet. Digestive issues like nausea, abdominal cramps, or even mild mood changes can occur. These subtle signs often go unnoticed. These symptoms appear when the body lacks vitamin B5, also called pantothenic acid. Pantothenic acid is crucial for producing coenzyme A-CoA, which is essential in fatty acid metabolism, energy production, and synthesis of important molecules like hormones and neurotransmitters. Low levels can disrupt these processes, especially in energy-demanding tissues. Foods such as eggs, poultry, fish, whole grains, and avocados are rich in pantothenic acid and help the body maintain proper metabolism and overall energy balance. Vitamin B6, pyridoxine deficiency. You may start noticing irritability, mood changes, or difficulty concentrating. Sometimes there is tiredness, a tingling sensation in hands and feet, or small cracks at the corners of the mouth. The skin may become flaky, and the tongue can appear swollen or sore. These symptoms can happen when the body lacks vitamin B6, also called pyridoxine. Vitamin B6 is vital for amino acid metabolism, neurotransmitter synthesis, and hemoglobin production. Low levels can affect the nervous system, leading to neuropathy or mood changes, and interfere with red blood cell formation. Good sources include poultry, fish, bananas, fortified cereals, and potatoes, which help maintain nerve function and overall metabolic health. Vitamin B9, folate deficiency. You may start feeling unusually tired, weak, or short of breath. Some people notice pale skin, irritability, or difficulty concentrating. Digestive issues, such as poor appetite or mild diarrhea, can also appear. These problems occur when the body does not get enough vitamin B9, also called folate. Folate is essential for DNA synthesis, cell division, and red blood cell formation. A deficiency slows down these processes, especially affecting rapidly dividing cells in the bone marrow, leading to megaloblastic anemia. Leafy green vegetables, legumes, citrus fruits, and fortified cereals are rich in folate and help maintain healthy blood cells and proper cellular function. Vitamin B12, cobalamin deficiency. You may notice persistent fatigue, weakness, or shortness of breath. Sometimes the hands and feet feel tingly or numb, and balance or coordination may be slightly affected. Mood changes or difficulty concentrating can also appear. These symptoms occur when the body lacks vitamin B12, also called cobalamin. Vitamin B12 is essential for red blood cell formation, DNA synthesis, and nervous system function. Low levels can lead to megaloblastic anemia and peripheral neuropathy, affecting both blood and nerve health. Foods like fish, meat, eggs, and dairy are rich in B12 and help maintain energy, proper nerve function, and healthy blood cells. Vitamin C deficiency. You may start feeling unusually tired, weak, or irritable. Sometimes the gums become swollen, red, or bleed easily, and small bruises may appear on the skin. Slow healing of cuts or frequent infections can also occur. These problems happen when the body does not get enough vitamin C, also called ascorbic acid. Vitamin C is essential for collagen synthesis, wound healing, antioxidant protection, and immune function. A deficiency weakens connective tissues, reduces resistance to infections, and can lead to scurvy in severe cases. Citrus fruits, berries, bell peppers, tomatoes, and leafy greens are rich in vitamin C and help maintain healthy skin, immunity, and tissue repair. Vitamin D deficiency. You may notice persistent fatigue, muscle weakness, or mild bone pain. Over time, bones may feel softer or more fragile, and some people experience mood changes or low energy. These symptoms occur when the body does not get enough vitamin D, also called the sunshine vitamin. Vitamin D is essential for calcium and phosphorus absorption, bone mineralization, and immune function. Low levels can lead to rickets in children and osteomalacia in adults, weakening bones and increasing fracture risk. Foods like fatty fish, fortified dairy products, and exposure to sunlight help the body maintain adequate vitamin D for strong bones and overall health. Vitamin E deficiency. You may notice muscle weakness, difficulty coordinating movements, or problems with balance. Sometimes there is numbness or tingling in the hands and feet, and vision may become slightly affected. These symptoms occur when the body lacks vitamin E, also called tocopherol. Vitamin E is a powerful antioxidant that protects cells from oxidative damage caused by free radicals. It also supports nervous system function and helps maintain healthy skin and eyes. Low levels can lead to neuromuscular problems and, in rare cases, vision issues. Foods such as nuts, seeds, vegetable oils, and green leafy vegetables are rich in vitamin E and help maintain cellular protection and nerve health. Vitamin K deficiency. You may notice that cuts or bruises take longer to heal, or that bleeding gums and nosebleeds occur more easily. In some cases, small red or purple spots may appear on the skin. These problems happen when the body does not get enough vitamin K, which is essential for blood clotting and bone health. Vitamin K is a cofactor for enzymes that help produce clotting factors in the liver. Without enough vitamin K, the blood cannot clot properly, increasing the risk of excessive bleeding. It also plays a role in calcium binding in bones, supporting bone strength and density. Foods like green leafy vegetables, broccoli, Brussels sprouts, and certain vegetable oils are rich in vitamin K and help maintain proper clotting and strong bones.